John Park. John is the Chief Strategy Officer at Allegis Technologies. Throughout his career, John's been at the forefront of healthcare consumerism as a movement. Prior to joining Allegis, he was a senior leader in the healthcare strategy and marketing team at Cigna, responsible for developing strategies for alignment and clarity across the organization. He was also a founding member of Definity Health. John, how does consumer-driven healthcare and defined contribution tie together with respect to this whole consumerism movement?
Yeah, so I think it makes sense to take a step back and talk about why now. So defined contribution is a concept that's been around for quite a while. So why now? Why does it make sense today? I think the data on these charts are everyone should be very familiar with this. I think we all recognize and understand that the healthcare spending in this country has outpaced economic growth for many years now. And we don't see any change to that going forward. Unless there's some significant changes to the way that the marketplace operates, we don't see that changing anytime soon. Subsequently, you'll see on the chart on the right that the consumer out-of-pocket expenses are also increasing and continues to rise and will continue that path as well. So what does this mean? So today, consumers spend over $300 billion in out-of-pocket expenses for healthcare services, which is significant and it continues to grow. Part of that is because of premium increases, but it's also because people are signing up for more deductible-based plans. In fact, since 2006, it's tripled. Went from 10% to 31% as far as the people enrolled in high deductible health plans with over $1,000 deductibles. So what does this mean going forward? We're going to see continued growth in these consumer spending accounts, FSAs, HSAs, and HRAs. And if you look at the distribution on the chart on the bottom right, you'll see that a lot of that growth right now we're seeing is going to happen with the HSAs and HRAs. And FSAs will remain relatively flat. Okay. So what does this mean? When you talk about consumerism, you talk about how it's progressed over time in the last 10 to 15 years. We moved from a defined benefit model. So if you look at this chart on the left, you'll see the orange area kind of being the employer's responsibility. That is significantly greater than the employee's responsibility when it comes to selecting healthcare benefits. So in today's model in the defined benefit world, the employer takes on most of the burden of selecting plans and taking on a lot of the financial burden. Now, the consumer has limited choices in this model, and they generally select plans that are based on co-pays and co-insurance and what I would call some more of the traditional plans. If you look at how consumerism entered the market, what we really tried to do at Definity anyway, John, you can probably remember this, is it was about shifting more responsibility to the consumer. And in this case, it was a benefit design that basically told the consumer, you're going to be responsible for how you access healthcare and to use your dollars more efficiently and effectively. And then came the need for these consumer spending accounts, being the HRA and HSAs. So what we saw in that was the creation of the tools that were needed in a consumer model, like transparency, like decision support, like being able to make better decisions as a consumer of healthcare services. So we talk about consumerism. It's not just about a benefit design, but it's an orientation in which the marketplace takes as it relates to the healthcare services that are being provided. So then comes the next generation, which is what we're calling defined contribution. Just to provide some clarity here, defined contribution and marketplace or private exchanges are not interchangeable. So you can stand up a marketplace without incorporating defined contribution. The defined contribution model is really a shifting of the responsibility from the employer to the individual relative to selecting and purchasing a benefit that meets the consumer's needs. So as you can see, there's an increase in the employees' responsibilities and a decrease in the employers. Now, in this model, we're seeing a lot of variation in the marketplace. And so in some cases, employers will take a higher level of responsibility, and in some cases, they're taking a lower level of responsibility. The trade-off for the employee here is that I now have more responsibility, but I also have more choice. And I have the ability to make decisions around my benefits that are right for me and for my family. And so defined contribution is a model that I think a lot of people will embrace. I think it's going to be a transition. Very similar to when we started Definity and incorporated and introduced a new benefit design. I think this is going to require a transition period for consumers to really understand how to best utilize and get the value from defined contribution. So in this model, you're going to see variations, and I think we're going to talk about a few of those today. You're going to hear things like group exchanges, individual exchanges, single carrier, multi-carrier. There's a lot of different variations that are being employed today in the marketplace. And I think today there is no one right answer. I think there's going to be a lot of different solutions out in the market. And I think there are a couple things that will be true. One, this will take time. So it will take a few iterations, a few cycles, and I think there will be a lot of learning in that process. I also think that there's a transition, and I think that the employer and the brokers will actually play a critical role in that transition. So very similar to the adoption of CDH, I see there being a very strong relationship in the defined contribution market. And we also mentioned, I think you showed some stats about the adoption. I think our experience, it's consistent with yours, for Allegis, we've seen for their very earliest stages 40 to 60% adoption into deductible-based plans or account-based plans when given a choice in a private exchange environment. Okay. All right, so the last slide here is really talking about the next generation of defined contribution. So we talk a lot about it today in the healthcare benefit sense. I think overall as an employer, this will evolve to be employed in more of a broader benefits conversation, which it's already starting to happen, but we're going to see more of that going forward. We also believe that incentives and wellness will be an important part of this as we talk about engaging individuals and making sure that they're incorporating the right consumer behaviors from an employer standpoint. So I think that's going to be an important evolution in the product, in the defined contribution solutions that are out in the market today. Okay.
Next slide is your follow-up here.
Oh, yeah.
How quickly and which sectors will adopt defined contribution for healthcare?
I've gotten this question many times, and I don't think there is a crystal ball that will tell you the right answer here. We've seen today, I think, the early adopters take on, and incorporate defined contribution, but they've been doing it in kind of a pilot fashion. So you're seeing a lot of it for retiree medical. You're seeing it for part-time workers, employees. And I think you're going to see that spread. Now, the way that I usually answer this question is it's any sector that is experiencing increases in healthcare benefit costs, which is pretty much everyone. I believe very quickly in the next year or two, there's going to be significant uptick in every sector when it comes to defined contribution. And it's going to be aligned to the various models that we had talked about, whether it be group or individual.